Hi, my name is Matt Hendrickson. I'm a Vice President with DO USA. It's my pleasure to welcome you today to our DDA session. DDA stands for the DO Digital Academy, and we offer the DDA in two different versions. A basic version where we walk you through actually placing an implant step by step as you optionally follow along on a typodont that we can send you if you desire, or you can just watch us go through the steps step by step, and we handle all of the basic coverage and detail of the DO Navi surgical kits, the protocols, and every step that's required to go through and place an implant using the typodont as an example. The advanced session of the DDA, we're going to actually walk you through an actual surgery on a live patient. Today's course will be an advanced course where we'll be walking through and we'll take you from the beginning of evaluating the patient as they present, basics of the surgical plan, and actually walk you through the live surgery real time so you can see the clinician placing the implant using the DO Navi system as we progress. Since today's course again is the advanced course, there will be some references back to items that were covered in the DDA basic session. So if you haven't been through the DDA basic sessions or the DDA on the typodont, again we encourage you to go back and watch those sessions as well. To give you a little bit of background on what DO Navi is, DO Navi is a world-class, literally the best in the world in my opinion, guided implant system that's going to walk you through surgical placements unlike any other guided system on the market. It's very unique because the planning is so simple and streamlined that it makes it very easy for you to upload your cases to our DO Navi planners where we can then plan the surgical case for you. We send that case back to you and you approve it or ask us to make any modifications. And then once the case is approved, we literally send you what we refer to as a case in a box. And that case in a box is then going to have everything that you need to perform that implant placement. Even possibly right down to the implant fixture itself that are appropriate for that plan. But in that box will be the implant guide that will go in the patient's mouth, like as I mentioned, the implants themselves, possibly a custom abutment if appropriate or the appropriate anatomical abutments. It will also include a drilling protocol that will walk you through step by step as you go through and place that implant. And even if appropriate, it'll include a screw-retained temporary crown, so you have everything start to finish all in one spot. It's very unique. So today's course won't really get into much about implant specifics, but it will be very specific to showing you how that DO Navi system works to really let you do the most efficient surgeries possible, safely, predictably, with just fantastic clinical outcomes. The DO Navi system is built using the DO implant fixtures, which is a world-class implant manufacturer, providing the absolute best in implants and its other associated attachments. Also, DO offers some really unique cutting-edge technologies, such as their UV activator, which is actually a chair-side UV activation system to absolutely provide the ultimate in hydrophilicity of the implant and maximize the speed that that implant integrates and is ready to restore. As you'll see as we go through this today also, the surgical guides are fit phenomenally and just provide absolute ultimate in accuracy as well. The DO Navi system also streamlines everything that you do to the point where literally almost everything that you do is placed through the guide. So as you'll see as we go through this as well, there's very little need to remove the guide and replace the guide during surgery. Again, the end result is absolutely the ultimate in predictability, simplicity, speed, comfort for the patient, and clinical outcomes. So with that said, I'd like to introduce our speaker today. You're really lucky to have a phenomenal lecturer who's going to be teaching this course, Dr. Riley Clark. Dr. Clark is a graduate from Case Western Reserve with a DMD degree. He's an implant-only dentist. He also holds certificates in IV sedation. He's a clinical mentor and lecturer and fellow at the Whitecap Institute, which is a world-renowned implant training facility in Utah. He's adjunct faculty at the University of Utah School of Dentistry. He has a master in implant prosthetics, and he's a board-certified diplomate of the International Congress of Oral Implantologists. But most importantly, Dr. Clark is the go-to expert when it comes to guided implant surgery. Dr. Clark has experience with just about every guided implant system out there on the market. In fact, he's consulted with many of the guided implant companies. He does use the DO Navi system on a regular basis every day, so you really have a great opportunity, and it's going to be a real treat for you to have such an expert walk you through these DDA sessions today.
Thanks for that introduction, Matt. I'm excited that you're able to join us for this DDA session. Let's go ahead and jump right in. So first topic, DO Navi technology introduction and clinical value. I'm excited to talk about this with you. as I've had a lot of experience working with other dental implant companies, dental implant guide companies, different laboratories, and I've seen what's out there, which makes what I'm about to share with you even more meaningful to me and in my practice, because it really is a level above the competition. Let's go ahead and get started. I want to play this quick little video for you to get started, okay? Here's a fun little video. I'd like to go through it and highlight some of these technology pieces that really sets DeoNavi apart. So here you're seeing an edentulous spot in the mandible. We're always going to start with a prosthetic tooth first. So a tooth is going to be placed in the virtual world, and we're going to make sure it is in the ideal geometry to match the final restoration. From there, the implant is designed with respect to the anatomical structures around that area. And then, of course, complementing the prosthetic plan of the tooth. Here you're seeing the use of a special abutment called an anatomical abutment. That's going to be key in some of the workflows of the DeoNavi system. So here's the process, the implant coming right off the 3D printer. This 3D printer is specifically designed from DeoNavi to seamlessly work within their workflow. Their implant surface, the most contemporary implant surface on the market. And now you're going to see that implant be supercharged, so to speak, with the chair-side UV activation process. This is going to enable the implant to be even more hydrophilic, lending itself to faster healing time and a stronger implant at the end of the day. Here's the anatomical abutment you're seeing, custom fit for each area based on analysis of hundreds and hundreds of formerly made custom abutments. Now you're going to see the many clinical situations that the DeoNavi system is complementary to. Anywhere from edentulous areas, anterior aesthetic cases, posterior sinus cases, you name it, DeoNavi has a great solution for it. All right, moving on, I'd like to focus in now on that UV activation for a little bit. Through this process of UV activation, the dental implant surface is removed of debris or hydrocarbons that can build up on the surface of the implant, producing a more hydrophilic implant. That's what you're seeing right here, is that process through UV activation, creating a more pure, activated surface of the implant. Here you're seeing a competition test, if you will, between two other hydrophilic implant surfaces and the Deo UV surface. Amazing to see that hydrophilic property with a chair side activation. Really, really impressive. That UV implant I'm seeing routinely placed, and 4 to 6 weeks later, ISQ readings well above 70. That's really, really exciting to offer that to our patients. They no longer have to wait as long as they've been used to, and then we can get to the restorative procedures even sooner. It's a win-win for everyone. This really is a unique thing about DeoNavi. Their guides fit remarkable. Like I said, I had worked with lots and lots of different implant companies, different guide companies and labs, and I've never seen a guide fit with the precision and the accuracy of the DeoNavi system. It's a wonderful fitting guide to see it perfectly marry itself with the anatomical structure of our clinical crowns or our soft tissue guides. It's a very, very well-fitting guide. End of the day, we can thoughtfully plan our implants, we can tweak it all we want in the virtual world, but if that physical guide does not seat properly with precision, all of that thoughtful planning in the virtual world will not translate to any type of clinical benefit. And so I really appreciate a wonderful fitting guide, really, really important to a final outcome that we're really proud of. Another unique thing with DO Navi, when they send my surgical reports with me, I get a structure map just like this that shows me how dense the bone is going to be around the body of my implant. If I'm preparing for my drilling protocol, whether I want to undersize the osteotomy or make it a true size, if I'm considering primary stability for immediate loading, a topography map like this helps me understand what type of density we're going to be experiencing while drilling. So through a Hounsfield unit measurement in the software, we can go before surgery even happens and make some clinical plans based on what the bone density is going to be like. I appreciate that extra boost of confidence to understand what the situation is going to look like clinically. As you know, bone quality makes such a difference in our implant cases when we talk about loading, primary stability. This takes a little bit of the mystique off of that analysis of what is it going to be like. Another thing I really like with DO Navi is their drilling protocols. They'll show up on a sheet just like this, and this sheet just makes it seamless and easy to understand what the protocol is. Not in words, but in pictures. Anyone can read it, anyone can understand it. It makes it even easier for me as a clinician to be there and to see exactly what the drilling protocol is going to look like. As you can see at the bottom, there's a D3 step where you would end after density 3, and then there's a D2 or D1 step, giving you some insight to what you might undersize your osteotomy as in preparation for primary stability. I like this. It's thoughtful, it's clever, it's streamlined, it's easy, it's convenient. That might be a theme of just what the DO Navi system is, and this little picture form of their drilling protocol kind of epitomizes that exactness of what DO Navi can do for you. Makes it easy and simple for you, so you don't need to think any harder than you have to. Last thing I want to mention when we talk about this is this anatomical abutment. These anatomical abutments, again, are designed from analyzing hundreds and hundreds of custom abutments. And they came up with some unique geometries, and those geometries are very complementary to soft tissue contours in the mouth. So you don't need to pay the price for a big old custom abutment, but you still get the benefit of an anatomical abutment that can go in, be very thoughtfully crafted relative to the soft tissues, could theoretically stay in the mouth the entire time, never needing to be removed, because it also doubles as a scan body. So this can be scanned in the mouth, and then from that impression, a final prosthetic can be planned. I appreciate the thoughtfulness with soft tissue. Soft tissue, we know that if we can put an abutment in early and leave it undisrupted, then with that, we will have a long-term soft tissue connection around these titanium surfaces. And so I love the idea of an anatomical abutment going in the day of surgery, staying in because it does not need to be removed for impression taking, and then being our final abutment if that's what you choose. It's a really clever abutment. It's a little more economical. It's very thoughtful to soft tissue. I think it's a very, very clever idea. They come in a variety of sizes, as I mentioned. You're seeing some of the size options right there. Based on anatomy, based on size and shape of the surrounding teeth and tissues, you'd select the right one from that. It's all done in the digital world, though, for you. So in the digital world, they can measure, look at that, hand select the right one for you. Just a couple of more slides I have here. This is a really cool case I did just a couple of weeks ago. What I love with this slide here is it really highlights, in essence, what the DO Navi system does for me, for my practice, and my patients. This patient came in under 15 minutes. All of those implants went in with the guide, with surgical precision. The patient left thinking, have we even started? I love a system that lets the patient feel like they're a king or queen. I love a system that lets me as the clinician feel like I'm doing a great job for my patient, saving time, saving stress, and to get 3 implants just like that, parallel, thoughtfully planned, relative to our prosthetics in a way that is efficient, good use of time, everyone is winning. My patients appreciate it, my clinic appreciates it, I certainly appreciate it as the clinician. I think that tells a big story right there. So when we talk about this technology and how does it really benefit us as providers, I think that X-ray tells the whole story right there. Maybe one last little thought. What I love also with DO Navi, it's this idea of a case in a box. And so one case gets sent to me, I open it up, it has my implants, my guides, my healing abutment, or my custom abutment, or my anatomical abutment, with a prosthetic crown, with my drilling protocol, all in one box. In terms of organizing our implant cases, coordinating with this lab, or this manufacturer, this really streamlines it. There's only one place, DO Navi, I talk to them, and they get the whole thing from A to Z figured out for me, and it just makes it a lot easier for organizing our cases. I really appreciate what the case in the box can do. And so those are some of the things that I think are highlights of the DO Navi system, how the technology benefits you, me, and the patient. I hope you enjoyed that. Let's keep moving forward. All right, now we're going to jump into our actual clinical cases. What I have up here is our very first case. This is number 10 implant in an edentulous site. As you can see from the profile of the tissues, there is a little bit of a concavity on that buccal surface. Ideally, I would have liked to have done a facial augmentation to create more uniform look. That unfortunately was not in the budget for the patient. Luckily, the bone that is there is going to work beautifully to get an implant in and still, I think, give us a screw retained restoration. And so in analyzing this case right here, tissues, tissues, tissues. We have to evaluate the tissues in our clinical cases. I like the amount of keratinized tissue. I like the biotype. The only thing that I would say is a strike in the negative is the fact that we have a little bit of a concavity right there. Overall, I really like this site. Let me just show you a couple more pictures of this case before we jump in and do our live surgery. So here you're seeing just an occlusal view. Again, you're seeing good tissues. You're seeing that she also has distal edentulous areas. We're going to treat those at a different time. Today the focus is number 10. Here you're seeing another view that's going to highlight some of the buccal contour issues. So there again, you're seeing the tissues look really good to me, and then a final picture, and then we'll get into some of the virtual planning, the anatomical analysis of the osseous structures that we looked at. So one more site right there. That's our goal for today, is to put an implant in there with a custom abutment and an immediately delivered temporary. We'll see how surgery goes in a little bit, but now let's jump into the CTs and look at the bone. As you can see, ample bone. You still see that buccal concavity, although she's just lucky her anatomy happens to have good buccal lingual width, and we can easily fit an implant in there with good bone all the way around the implant. And so I like that. I don't see any concerns there. Obviously, we don't want to go too apical. We'll run into the floor of the nose and the sinus area, but the roots of the teeth are nice and parallel to each other. We have good bone quality. I'm really excited for this case. I think this will be a really good one. Let me show you what came from the DO lab in terms of a planning standpoint. So right here, you're seeing exactly a screenshot of what was in my DO Navi portal that shows the planning from our laboratory. You're seeing a prosthetic tooth being planned, and then the implant being positioned relative to the osseous structures, and of course the prosthetic tooth. You can see our implant has at least 1.5 millimeters of bone around the buccal, around the lingual. We have about 1 millimeter or so before the floor of the nose, and then you see the angle of our implant fits nicely relative to the shell of our prosthetic number 10. So that's our case for today. I really like the way it looks, and I just want to highlight one more thing, and that's this case in the box I did. So here's the box that came from my patient. You see the surgical guide, you see the dental implant, my custom abutment, 2 different temporaries, hopefully to get the shade just perfect. I ordered 2. Don't have to do that, but I'm a little bit OCD, so I thought let's order 2 and make sure we get the shade just perfect. And then you see a backup healing abutment if we decide for some reason not to put the temporary in today. So as a review, this number 10 site is going to be a narrow platform implant. It's a 3.3 diameter. We are going to use our narrow kit for this procedure. So make sure you have your narrow kit, because this is what you're going to use on your narrow platform implants. That's our case in the box. That's our case number 10. Let's go and jump into surgery. So we've got our patient here. She is lightly sedated. I went ahead and put just about a carp in the buccal and maybe a quarter a carp at the palate. I used Septicaine 4%, 1 to 200,000 epinephrine. and just waiting for it to soak in a little bit. The first thing we're going to want to do on any case is to make sure we try our guide in and it fits properly. This is always an exciting thing, because if this guide doesn't fit just beautifully, we can't start with our surgery yet. So I'm going to go ahead and roughly seat it, and then once I feel like we're lined up, I'm going to put some good pressure, and this one literally clicked into place, which I will take. And then my eye likes to look right around here, make sure it's sitting nicely, buccal contour. You're seeing same thing right here, same right over there. And if I get a mirror, you can check the distal areas as well. All these little windows are there to help you visualize the guide seated everywhere. Real big for me if you can. Beautiful. That right there is beautiful. That could belong in a textbook. Look at that. Beautiful fitting guide. No rocking or anything. Where we're going to focus right now is in this site. The fact that I see a gold sleeve means that this is a narrow implant site. The other ones are blue, blue, and so here at gold is a narrow implant site. So I love that. That fits beautiful. Okay, so I love the way the guide fits. Looking at our drilling protocol, we're going to start with a tissue punch and then the bone flattening drill. I'm at 100 RPMs. Yeah, it's going to be just great. No talking right now though, okay? Real big for me. Turn my way a little. So this is our tissue punch. Again, it has a beautiful radius blade is what I call it, and that radius blade will scrape the bone, actually teasing the soft tissue off the bone. You'll see that here in just a second. I like to push. Real thick tissue here, wiggle around, push hard, come out, and the tissue, you see some of it stuck right there. I'm going to go ahead and irrigate, and I'm going to run down one more time. There it is. There's the tissue you typically see it on the side. Here's a little trick. I have my assistant come and just suck that right out of the side. Sometimes it works. Not today, it's stubborn. We'll leave it in there, but that's the tissue punch. Now we're going to use our bone flattening drill. We're going to go to the bottom, meaning the more apical part of this black line, okay? Oh, already there, pretty soft on top. A little bit of bone, irrigate. We're then going to use our drill tube. This drill tube gets inserted all the way down into this. Looks like it's being held up just a little. I think we're going to be just fine though. First drill is a 7 drill, 2x7. I'm going to put the 2-7 here. Constant pressure all the way down, 10 seconds of drilling all the way down, and then up, and irrigation. Beautiful. Now we're going to do a 2x13. Here's our 2x13 drill. That might be stopping me just a little, but that's going to be just fine. I'm going to go ahead and take this out. Assistant is going to irrigate. Following our drilling protocol, we're going to do a 2-5x7. So there's my 2-5x7 drill. This part is going to be used to stabilize itself within the guide. So I'm going to seat it until it's all the way flush with bone. Then I'm going to run. Pretty soft. If you're looking at our drilling protocol, it recommends going to a 2-5x13. I'm going to make an executive decision, and I'm going to go 2-5 to 11-5 only, and I'm going to put our implant in actually. So 2-5x11-5. I'm going to leave the apical end not nearly as drilled, hoping to get more primary stability there. I want to put an immediate temporary on this, and so primary stability is very important. I'm actually done drilling at this point. So now it's time to put our dental implant in. We're going to go ahead and activate our 3.3 by 13 in the UV activator. Okay, our implant's been UV activated. I'm going to go ahead and take our implant. There's our implant. My motor now is at 30 RPMs, 35 of torque. Real big for me. I'm going to push this as far down as it will go. That's about it. And again, bottom of this black line is going to be my stopping point. As you know, the kit here is a 12 millimeter offset. That is the narrow. It's already showing some torque, and it has a ways to go, but I'm optimistic that I want this torque value. Still going. I'm just about there, and obviously, so I have about 1.5 millimeters left. I'm going to go ahead and use the torque wrench to do this. Now here's something unique with the DO system. I do need to line up properly with one of the indicators on the guide sleeve. As I get closer, I'll point that out. I got this on backwards. So right there you see it's basically lined up, but that is not all the way to depth. So I'm going to take this to depth. It is not getting any tighter just yet. Almost to depth. Right there would work. I'm going to go a little more. I'm going to go one more past that, and right there I'm going to go one more right there. Let me point this out with an Explorer. This is a really important part of this procedure. This right here, this little indicator here to there has to line up with the indicator on the driver right there. And so as you can see, that looks nice and lined up. I like what I'm seeing there. This side is lined up perfect. That one's a little short for some reason, but I think we're really, really close. I might move it just a smidge right there. With that lined up, the hex rotation of the implant is going to match the hex of our custom abutment. So I really like that. I'm going to go ahead, take this off, and then we're going to see how everything else fits. Sometimes these mount drivers are a little tricky to come off. I like to grab them with the rongier, slight little wiggle movement, and get this to come out. They are really tight in there. That's nice because it lets the implant be nice and tight in terms of its surgical accuracy, but sometimes it's challenging to come off. So now we'll take this off. I'm evaluating now our surgical site. First thing I like to do is take an Explorer and just make sure I feel bone all the way around the top of the implant. So I find the implant, go to the top, make sure I'm going to use a perio probe to get over this central. Yeah, I like what I'm feeling there. That looks pretty good. Let's take a mirror and let me take a peek. Little thin on the palate. I think we kind of knew that. In the implant up, there is good bone around there though, so I like what I'm feeling there. All right, now we're going to take our custom abutment. So here's my custom abutment. Here is a temporary crown. You see the hex orientation there. We're going to do the best we can to suction some of the blood here. I'm going to try to hold this in the right position. I'm going to hold that roughly in that position and tighten the screw and see how we're lining up. Does this even... Seems to be seating decently there. You're seeing the custom abutment in place. To me, it does not seem like it's rotated the exact way. See how it's rotating a little on me there? Let's take that crown again. So let's try this one more time. Appears to be down all the way. Let me go ahead and take this off. This looks like it's in a good position. We're going to go ahead and take an x-ray and look at the seat. Okay, real big for me. How big can you open? There you go. So now it looks like the abutment is seated properly. Let's go ahead and take one more x-ray to confirm. Put it up there. Real big. So there's the abutment in place. I'm going to go ahead and try our crown in now. Okay, real big. So there's the crown in place. Again, our color is close. It's a little bit lighter. I'm going to go ahead and floss these contacts. No proximal contact adjustment has been done. Let's see how they look. No marginal adjustment was done. I decreased the height just a little bit of the lateral. It was a little bit long. I'm going to go ahead and have my assistant hold, and I'm going to floss right on top. Beautiful little snap there. Keep holding. Let's check the distal. Beautiful. pretty remarkable. No proximal contacts done, no final impression obviously taken, but I'm seeing a crown right now that has perfect contacts mesiodistal because of the accuracy of the guide. I've done this quite a bit, but every time I do it, it still kind of blows my mind that that even works, that that's accurate. That's phenomenal. And in this case is all done. We've tried in the temporary, we've confirmed occlusion, we've looked at proximal contacts. I'm going to go ahead and cement the temporary. First thing I'm going to do is put a little Teflon in the back access, and then we'll put a little temporary cement on this abutment, double check occlusion, and in this case is all done. Here's a little Teflon. Chin up real high. Go ahead and water that, clear that up real good. Here's our temporary crown. I'm going to go ahead and put some temp bond clear in here. I'm a little bit liberal with this, knowing that a lot of it will just spill out of our screw access hole. But we will do a good job cleaning that up. There it is, pushed into position. Again, the shade was decent. Not a perfect match, but that is darn well a perfect solution for the patient. They came in with no tooth and a flipper, and they get to leave with that. We get to get the flipper out of there. She's going to love that. So that looks fantastic. We're going to let that set up. Let's see the patient close all the way down. See, we're not touching there. Looks beautiful. We'll fill that access hole in just a minute, and then we're all done. That's a great surgery. Thanks for watching, you guys. Okay, here we are now looking at the post-operative CT scan. I always love this opportunity, now that I have a three-dimensional x-ray, to ask myself, knowing what I know now, what would I do differently and why? That little retrospective thought or conversation can be helpful in just making sure we're always optimizing our surgical outcomes, and not just surgery, but any procedure that we do in dentistry. And so as part of the review of this live surgery that you just saw, looking at now a three-dimensional x-ray, we get a look at it and just make some decisions of what went well and what didn't go well as we reflect through the surgery. As far as implant placement is concerned, I'm really happy with it. You can see on the bottom right, we have really ample buccal plate. We have good lingual plate. It's a little bit thinner on the lingual, and I would always prefer it that way. If I had to pick the buccal plate or the lingual plate to be a little thin, I'd always want it to be the lingual plate. So I'm glad that we have a lot of robust bone on the front of our implant. I'm glad that the apical end of our implant engages just barely the floor of the nose, so that cortical bone is providing strength. It's positioned beautifully parallel relative to the other roots. Overall, the position of the implant in the bone I'm happy with. There's certainly more bone on the lingual of that implant than I think the CT makes it look like, however. I know that for a couple of reasons. Number one, I was in there. Visually, I detected it. I could tell there was more bone than I see on the x-ray. And number two, I've just worked with a lot of implants and CTs and know that you always get a little bit of just deficient looking bone, I should say, around that metal. And so I know that there's a little bit more bone there. But, you know, again, if I was really being nitpicky, I wouldn't mind it if that implant for style points was maybe 0.5 millimeter more buccal. And so I like that. So in terms of outcome, in our retrospective analysis, if you will, of our surgery, I'm happy with the outcome. I think the implant is in a good position. Its restorative position is sound. its position relative to bony boundaries is going to be good for long term. It is a little deep in the bone, but that's how deep it had to be in order to get bone around the lingual. It was a little bit thinner, and since augmentation was not in the cards for this patient, we were forced to put the implant a little bit deeper just so I could get good bone coverage 360 degrees around the implant. And that lingual side has a little bit of a concavity there that just made it a little bit harder to get bone coverage. So that's my thought as far as the outcome of the procedure. Really happy with that. You can see the abutment is nice and seated there. Overall, I think it went really well. I can't get over the fact that the patient was in the chair for maybe 15, 20 minutes. And we can put an implant in and immediately put in an abutment that fits with the orientation of the implant, and then a crown, PMMA milled temporary, that fits without any proximal adjustments. That's just remarkable. That's a nice complement to a really accurate workflow. The only other thing I want to mention about our surgical protocol and the steps involved is I chose during that surgery to not use one of the optional drills that is sometimes used, and that's called the abutment profile drill. You see it here blown up now. The abutment profile drill provides a little bit of relief of the crestal bone so that abutments, particularly custom abutments, can fit more gracefully without any bone interference. I did struggle intraoperatively for maybe a minute or two, maybe 3 or 4 minutes, getting the abutment to seat just right. And it could have very well been because of bone impingement. And so this abutment profile drill I chose not to use, feeling that the bone was very soft and probably not impinging. However, I think if I could go back and do the case over again, I probably would elect to use the abutment profile drill just to make my life a little bit easier and not kind of have that, wondering moment. I wonder if I should have used that. And so that was maybe one other thought I just wanted to bring up in the post-operative conversation. I don't think it's wrong to use this every time if you want. I typically only use it when I feel like the bone is very dense and definitely going to be in the way of some type of abutment I'm going to be placing. And I think I guessed wrong today on that surgery. And so I think that's the one thing I would also mention, is that abutment drill probably could have been used, should have been used, and it would have been helpful. Overall, I hope that the surgery was helpful, seeing it live. I hope you appreciated the ease of the system, the accuracy of the system. I think it's really, really neat to give patients that sort of treatment and that sort of time frame in terms of a short procedure, all the way now to a fixed temporary without waiting for healing or anything like that. We'll let that implant heal up, probably 2 to 3 months, and then we'll get in there. We will remove the temporary, and we'll take some final impressions to have the final crown made. If all the tissue looks perfect, that abutment that was placed will stay in there the whole time. If not, then obviously it'll be replaced with a new custom abutment. So that's kind of my post-operative conversation around that case. I hope you enjoyed the surgery, and those are just a few thoughts I have about kind of how surgery went.